All right. Well, it is 12 o'clock, so I think we'll go ahead and get started. Thank you so much for joining the lunch hour session on Apple Health or Medicaid. So if you have ever wondered about how youth in foster care access physical and behavioral health services, this is the lunch hour for you. So thank you so much for being here. My name is Lindsey Greene. I am with Coordinated Care. Coordinated Care is one of the Medicaid plans here in Washington, and it is the Medicaid plan for children and youth in foster care, adoption support, alumni of foster care through age 26, as well as for reunified families. So I'm going to talk a lot about what benefits are covered by Apple Health here in Washington, a little bit more about our specialized program for youth in care, and really just want to keep it as interactive as possible too. So please feel free to ask questions as we go through today. You can come off of mute and ask them out loud. I have no problem with you interrupting at any point if something isn't making sense. I also have a tendency to talk fast. So if I start talking too fast, please call me out and let me know that I need to slow down. We also know that there is a ton of jargon in health plan language and Medicaid and Apple Health. So if things don't make sense at any point or you need me to repeat anything, please do let me know. If you're not comfortable coming off mute, that is okay. Or if you don't have that capability on your device today, that's okay. Feel free to reach out in the chat as well. That's another way that you can ask questions as we go through today. So a little bit about me, Lindsey Greene. I've been with Coordinated Care for, it'll be 6 years next month. So have been with the program since before we actually launched in April of 2016. And so grateful to be with all of the CASA staff and volunteers at this conference today. I so appreciate and enjoy working with CASAs. And prior to my role at Coordinated Care, worked for the department in foster care and CPS, both here in Washington and also in Virginia, where I'm originally from. So just so appreciative of the work that CASAs do and the advocacy that you all provide for youth. You're such a central part and such an incredible resource for our families. And I am just here today to help make sure that you feel like you have the knowledge and understanding you need about how kids access Apple Health services and just answer any questions that you all have. So with that, I'm going to launch a PowerPoint as we go through. And we'll provide this PowerPoint to you. I did just let Ryan know the one I originally provided, I added one more slide too, because we have a new resource that just launched. So I will be sure to get out the updated slide deck here momentarily as well. So let me get back up to the beginning here. Get us in slideshow mode. Is that looking like it's slideshow mode? Perfect. Okay. Yeah. So really, my key message today is, it's going to be impossible to remember all of the ins and outs of Apple Health, right? The key message, the key takeaway today is please reach out if you are ever frustrated or dealing with a challenging case where a youth is not accessing the physical and behavioral health services that they need, right? That's the key takeaway. You can reach out to us if you need help. So our main Apple Health Core Connections phone line is this 844-354-9876 phone number. A great way you can advocate is encourage every caregiver, relative caregivers, foster parents, maybe adoptive parents that you might know or work with, to go ahead and save that number in their cell phone, right? Because there's nothing worse than being at the pharmacy trying to pick up a prescription at 10 p.m. and like, oh, where's that Coordinated Care phone number? So we really encourage everybody to save that phone number in their phones so that they have it when they need it. And I'll also be sharing an email address where you can send referrals to Coordinated Care as well. Okay. So we are going to talk about who's covered, who's served, a little bit about the program, what happens when a youth is first entering foster care. Care coordination is the key central piece of what Coordinated Care is able to do to really help assist families and youth. And we'll give you all the information you need on who and how to contact all of us at Coordinated Care. So we'll start with who's served, right? Who's our membership? So the coordinated care, like I said, is one of 5 Medicaid plans here in Washington. And we have a special program called Apple Health Core Connections. So that is the Medicaid plan for children and youth who are in foster care, adoption support, extended foster care, and alumni of care through age 26. As well as for children and youth who are reunified with their parents 1 year post-dependency, they can stay with this program. So statewide, we have about 25,000 members, broken out into all of those areas. So children who are currently in an out-of-home placement, youth who are in adoption support, youth in extended foster care or alumni. So really what we're getting at there, when the youth turns 18, regardless of whether or not they choose to participate in extended foster care, they remain covered by Medicaid through the month of their 26th birthday. And just kind of backing up again, Medicaid and Apple Health are really synonyms, right? They can be used interchangeably. So you might hear me do that a little bit today. So Apple Health equals Medicaid, Medicaid equals Apple Health, right? Those are the same kind of term. And again, Apple Health Core Connections is the Apple Health plan for children and youth in foster care, adoption supports, alumni, and then families that are reunified can stay with us for 1 year post-dependency. There are a couple of exceptions to enrollment. So if you have any American Indian or Alaska Native youth on your caseload, they may or may not be enrolled with us. If they are not enrolled with us, then likely what they have is fee-for-service coverage or provider one. And we'll talk a little bit about that today. For children and youth who end up with a placement outside of Washington, we don't have a provider network in other states where a child might be placed, right? So if they leave Washington, there's kind of some different processes that happen to help ensure that they have coverage out of state, just not through our health plan. If it's a youth that's entering Washington state from another state, they may or may not be eligible for our program, and we can help with all of those kinds of questions. So anything that kind of gets in the weeds with eligibility, you can feel free to reach out to me or our team, and we are happy to assist and check and see if they are eligible. The other one is when a youth enters juvenile rehabilitation or a JRA or detention facility, during that period of time that they are in JRA, they have medical coverage, but it's not through coordinated care. So their coverage should never lapse, right? They should automatically re-enroll with us and have full coverage from the time of the release. But their coverage looks a little different while they're with JRA. So those are kind of the big ones. And then if they have other insurance, so most often that happens for our adoption support members, right? So if an adoptive family chooses to enroll the child on their private health plan that they might have access to through an employer, then Medicaid coverage can be secondary. They can still get some Medicaid benefit, but it's through that fee-for-service or provider one system. Okay, so any questions on that? That's kind of a lot. That's probably the most jargony portion of today, but like to just kind of give a little bit of an overview of who is covered. And again, if you have eligibility questions or you're thinking about a nuanced case, feel free to reach out and we can do some looking for you. All right, I'm not seeing anything in the chat, so I'm hoping that means you're following me. So a little bit more information. If you do have a youth that is maybe in a trial return home and you think the family would benefit from staying with Apple Health Core Connections for a year after the dependency is dismissed, they should receive an application from the Healthcare Authority, which is the state agency that oversees Apple Health. But if they don't, or completing a paper application is a barrier, the best process is to call the foster care medical team at Healthcare Authority and just do the application over the phone. It takes about 10 minutes for families to complete. And there is currently not an online application option. So I know that can definitely be a challenge. But again, our team is here to help. So if there's any challenges in completing that application, they can definitely feel free to reach out to us. Some basics. So why does the Apple Health Core Connections program exist? We exist to make things easier, right? Our goal is to assist caseworkers and caregivers and CASAs and everybody that's involved with a youth and the youth themselves in making sure that they have timely access to needed physical and behavioral health services And we believe that when their whole person wellness and healthcare needs are met, that we can see results in all domains of life, right? Improved functional health outcomes, hopefully fewer placement and treatment disruptions, better medication oversight, and also hopefully more stability in school as well as in their placement, as well as just overall member and caregiver satisfaction. So really, we want to really help make sure that those physical and behavioral health needs are met to ensure that the youth can thrive in all areas of their life. So this comes up really early, right? How do I find out which providers the youth can go to? We do have a Find a Provider tool on our website. So you can see the arrow there points to kind of where you would find on our website that Find a Doctor tool or Find a Provider tool. So you go to coordinatedcarehealth.com and you click on that Find a Provider tool. And then you'll want to make sure you click on Apple Health Core Connections, right? So we have a general Medicaid plan or general Apple Health plan, as well as the specialized plan for children and youth in foster care. And there are a few providers out there that will only see our foster adoption support members. So it's important to just make sure you click on that Apple Health Core Connections button when you're trying to search for providers for these youth. I will say sometimes there are hiccups with it. Sometimes it doesn't work perfectly. Again, we don't always know, did a provider just decide 2 hours ago that they're no longer accepting new patients at this time, right? That's just one example. So if a family is struggling and they've tried the Find a Provider tool and it's not working, we really encourage them to reach out to us. And we can help kind of navigate and take some of that off their plates, right? We don't want them to have to call, all the dentists in their area to try to see who's accepting new patients at this time. So you can definitely reach out if families need support around finding a provider, but the tool is on the website too. So we encourage you to start there, and if that doesn't work, call us. So some of you might be wondering, what is covered by Apple Health or Medicaid here in Washington? The Apple Health benefits all have to meet medical necessity, and that's really determined by the state. So I'm going to show you just the general Apple Health benefits that are covered. You might also be working with parents or family members of a child who also have Apple Health, but may or may not have coordinated care, right? The physical and behavioral health benefits really are the same for each of the plans. So this is kind of helpful, I think, to see for just, what does Apple Health cover here in Washington? So this is what the ID card looks like. And then here is a list of a broad range of benefits that are covered. So medical services, doctor office visits, urgent care, in addition to emergency room visits, vision exams, prescriptions, hearing exams, hearing aids, durable medical equipment. DME can also include pull-ups for older youth that deal with enuresis or encopresis. So there does need to be, medical diagnosis and some documentation, but that is a part of the durable medical equipment program. Hospital care, home health, physical therapy, specialty therapies like speech or occupational therapy, lab tests, x-rays, family planning, disease management, transgender benefits, behavioral health, both outpatient and inpatient. And under that behavioral health kind of category, that also includes drug and alcohol treatment for substance use disorders. So that's kind of the broad array of what does Medicaid or Apple Health cover here in Washington. And we'll get into a few more of those specifics as we kind of go through here. Want to also share Teledoc. This is new to coordinated care in February 2020. So I guess I shouldn't say too new, it's been over a year now, but really couldn't have asked for better timing on launching the Teledoc partnership. So Teledoc is a telehealth provider that is in network and Washington based. So it's available for our members 24 hours a day for non-emergency issues. And basically members can connect with a provider without having to travel, right? So it's all electronic based healthcare visits. They can access it via the mobile app through their phone or on the website. So a family, if they wanted to enroll in Teledoc, they could go to the teledoc.com/coordinated care website there. And then they just need the child's name and date of birth, and they should be able to get an account set up. And from there, they can use it for appointments like cold, flu, fever, sinus problems, upper respiratory infections, smoking cessation, and some specialty care for dermatology, so rashes or skin conditions. And then behavioral health, you'll see a little asterisk there. Currently, behavioral health services are only available through Teledoc for our members 18 and up. So if you're working with a youth who might be in extended foster care and looking for a behavioral health provider, Teledoc could certainly be a resource for them, but not for those members who are under 18 at this point. The other question that usually comes up here is, what if a child has a pediatrician that already offers telehealth visits? Can they have telehealth visits through their already established pediatrician? Yes, absolutely. Telehealth visits, through their PCP are also available. But in addition, to supplement that, we also have this partnership with Teledoc, which includes providers that are based here in Washington and can be accessed 24/7. Yeah, so any questions on Teledoc or anything else I've said so far? All right. Pharmacy benefits, this is usually a big one people have questions on. The key piece here I want to share is many over-the-counter medications are actually covered as long as the family has a prescription. So, that child's going in for their well visit and maybe they need antacids or, athlete's foot cream or a bunch of other different over-the-counter types of medications. They could actually ask the provider for a prescription for that. And then not have to pay out of pocket for it. So that's a really great resource that families may or may not be aware of. One thing that we do notice sometimes is maybe a provider that's not familiar that they can write a prescription for an over-the-counter medication, or a pharmacy who's not familiar that they can fill a prescription for an over-the-counter medication. So if a family ever runs into any kind of trouble there, they can reach out to us and we can do some provider and pharmacy education as well and try to help navigate that and make sure they get what's needed. So a great program, and you can see here some of the over-the-counter medications that can be covered with a prescription. Diabetic testing supplies. Yeah, so lots and lots more. You can view that preferred drug list. The link is in here. Lice treatment, obviously, the medication can be covered, that's over the counter, but also many DCYF offices also have contracts with specific lice removal providers or agencies. So that can be another avenue if you're needing support, is to reach out to the caseworker. In response to COVID-19, we also found that many more families were interested in having medications delivered to their door and not having to go to a pharmacy to pick them up. So in response, we added a lot more medications to that 90-day maintenance list where families can have medications delivered to their door and they get a 3-month or 90-day supply. So if a family is like, that would be so great to get prescriptions delivered, they can also click on that preferred drug list and search, do Control F and search for the name of the medication that the child's on. And if it has the letters NP there, that means that it's part of our maintenance program and they can get that delivered to their door. So they can call us too. That's a great reason to call and get some help. I know that's a little complicated, but if you wanted the behind the scenes view, you've got it. Vision benefits. This is kind of an interesting one too, for those of you that work with youth in extended foster care. For youth who are 20 and younger, Apple Health covers 1 eye exam per year. And then once they turn 21, it's 1 eye exam with refraction every other year, right? Or every 2 years. So if you have a youth that's getting close to 21, right, make sure they're up to date on their eye exams. And also, Apple Health only covers glasses or vision hardware through 20 and younger. So once they turn 21, there's no longer a glasses benefit. So definitely encourage them to get those glasses or vision needs taken care of before they turn 21. People often ask about contacts. Youth that would love to wear contacts, is that covered? Only if it meets medical necessity, right? So sometimes contacts are more for sort of cosmetic reasons, right? And so in those situations, they would not be covered, but if it is medically necessary for the eye diagnosis that they have, then they are covered. I'm not going to go into this too much. This is pretty in the weeds. I kind of mentioned earlier, right, if a youth has private insurance through maybe their adopted parents and they get secondary coverage, right, they might be enrolled with what's called BHSO, or behavioral health services only. So they're kind of secondary coverage for Medicaid covered benefits around behavioral health are covered by coordinated care. So this is pretty nuanced, but if you ever did see somebody that had a card that had that, you can see kind of underneath the red apple over there, get my spotlight back, right? You can kind of see it over here. It says behavioral health services only. So that's like, oh, we need to call coordinated care. This is a little bit complicated. We need some help. And so what is covered under behavioral health benefits for Medicaid? Some of the most often used programs for behavioral health would be WISE, or wraparound with intensive services. PACT is a program of assertive community treatment for adults, and then substance use disorder treatment. So the whole range from outpatient to residential or detox services, and then medication assisted treatment is also covered. Another important piece to know, if you are ever working with a youth that is experiencing a behavioral health crisis, so either in a crisis state because of mental health or substance use disorder, and needing some crisis services, each region in the state has a crisis line. So the link to those 9 crisis lines are found in here, and you'll want to look for the county that you're in, see what region you're a part of. Some counties are their own region, and make sure you have that crisis line available, right? You want to make sure you know what that crisis line is. Make sure caregivers also know what their regional crisis line number is. Good to have that handy just in case you ever needed it. The crisis lines are the ones that are able to respond. They have the designated crisis responders that can make evaluations for when and if an involuntary treatment is needed. So here's what the provider one or fee for service card looks like. So I mentioned Native youth might only have this card. And then in addition, so if they have all of their health services under fee for service, this might be their only medical ID card. For children and youth that are in Coordinated Care's Apple Health Core Connections program and receive most of their coverage through us, they will still have a provider one number. And there are still just a couple of things here in Washington State that go through provider one instead of their health plan. So those services, the key ones here are dental services, eyeglasses, and some of the transgender benefits also still go through provider one. You can kind of see the full list up here. If you ever have questions about this, feel free to reach out. What I always say is no caregiver or youth should ever have to know if a provider is billing provider one or billing coordinated care, right? That should never really come up. And we still help our members connect to these services. So really should not ever be a barrier, but just kind of helpful information for you to know if you ever see one of those teal cards, you're like, what is that? That's what it is. We also have the provider one number available for members on their ID card with us. So their coordinated care ID card actually has their coordinated care number as well as their provider one number. So hopefully that is a help for them. Medicaid or Apple Health through provider one also covers transportation to and from medically necessary services. So that could include doctor visits, also drugstores to pick up medications. And the regional brokers will utilize, the most cost-effective means to get that member to where they need to go. So in some communities that might look like rides, in others it might look like gas vouchers, and others it might look like bus tickets. So just kind of figuring out what's available through your regional broker. But that is a resource that is available. And if you need help, if a family needs help getting connected to that, we can help with that too. So what happens when a youth first enters foster care from the medical side of things, from the health plan side? How are they covered? So youth are automatically eligible for the Apple Health Core Connections, right when they're entering care, but we don't have the data yet, right? So it has to get entered into the DCYF system, Safelink. It has to get over to the healthcare authority so that they can enroll the member with us. So it can take a couple of weeks. for it to show up that, they are in fact our member. But we know that youth need care right when they're entering, right? They need to have that first well child exam right when they're entering, maybe a dental exam. They might have other health needs as well. So to kind of fill that gap, we have what's called the interim voucher, right? So coverage begins immediately, but we might not have all the details yet. So we have an interim voucher. It's available on our website. It should go to families, when they get a placement as well. And they just fill in the information that they have, right? If they don't have all of it, that's okay. And take it to the provider. And then this is basically a form that goes to the provider that says, pharmacist, physician, this child is in out-of-home care now. They're eligible, just kind of waiting on all of those other pieces. So please hang on for just a little bit, and then you can submit that bill to coordinated care, and here, send us this information to kind of get started. So the interim voucher can be used for those medical needs that come up in the first week or so while a child's eligibility is getting all sorted out. So they can use it at pharmacy and provider visits. If there's an issue with it, that's again why we want those foster parents and caregivers to have our number saved in their phone, so they can call us right then and there when there's an issue, and we can kind of help navigate that. And after hours, if you ever have an issue after hours, that's when the 24/7 nurse advice line comes in handy. You can press 2 when you call, and then press 2 again for that nurse advice line. So that's the directions for after hours or weekends. And then when we receive a new member, there's a couple of things that happen. We auto assign every single youth to a primary care provider or a PCP. But sometimes what happens is that's not the provider that the foster family regularly uses. And it's not the provider that the family would like to take the child to. And so then there can be some stress and uncertainty about like, am I allowed to go to any provider I want that's in network? And the answer is yes, absolutely. So we call when our members are enrolled with us, and we can help confirm their primary care provider and make those changes in our system, answer questions about benefits, and identify any healthcare coordination needs. Are there any gaps right now that we can help connect a member with behavioral or physical health services? So again, sometimes that auto assignment for primary care can be a little bit concerning for caregivers, but it's a quick and easy fix, and they can call us at any time to get that changed. And we also reach out to them right when a member enrolls. So care coordination, I told you this is really the heart of what coordinated care is able to do. We really are there to help support our members connect to services. So here's how you reach us. This is our 844-354-9876 phone number. And then members press 2 for member services. And then the key phrase here, right, it's on the bottom of the slide. What we always want to say is ask for healthcare coordination. Ding, 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 ding. That's your key phrase that'll get you to the right team. So when you call us, you'll speak to a real live human being very, very quickly, likely in less than 30 seconds or so. And our call center can handle lots and lots of needs that families may have. Maybe they're requesting a new ID card, right? Those kinds of things, call center can definitely help with. But if there are ongoing needs or some gaps in care, the key phrase is asking for healthcare coordination, and that'll get you over to our specialized team that is truly amazing in helping connect youth who are involved in child welfare to the services that they need. The other thing that you can do is you can email us at ahccteam@coordinatedcarehealth.com. And then within a couple of days, you'll get an email back, or the family will get an email or a phone call back, and we can help get connected to care coordination that way as well. So sometimes people prefer to just shoot an email and then be able to schedule that first call, as opposed to trying to call and navigate the phone system. So either way is fine with us. Right, if it's a youth that would prefer to call or email, that's fine. The member can email or call us directly. Caregivers can do it as well. You as a CASA can make referrals for care coordination. If you're making the referral, I would encourage you to use the email system, and you can kind of just let them know that you're the CASA on the case. If there's not, and so then from there, right, we can reach out to that family and get care coordination or care management set up. So here are some real life examples from Washington State about times when care coordinators and care managers have helped. So if any of these sound familiar to you, maybe it was a case you helped on or advocated on. The child's PCP made a referral to an endocrinologist, but the specialist didn't have any openings for 6 months. Well, that's way too long to wait, right? That's not accessing the right care at the right time. So we can't always make appointments appear. We can't always get kids in sooner, right? We understand, especially with mental health, there are some limitations right now and some capacity issues. But this was one situation where we were able to call and really advocate on behalf of our member to get seen much, much sooner. The judge denied your request for ADHD medication and ordered the child to be seen by a naturopath for another opinion. That was another one that happened. And it just so happened there wasn't a naturopath that was in network in that member's area. So they were looking at pulling the child from school and having to, travel a great distance to get that need met. So we were able to work it out with a naturopath that was in the community to really help make sure the child's needs were being looked at holistically. And a teen needs behavioral health therapy, but is fearful of men and would not match well with a male therapist. Right? That's another, finding that culturally responsive healthcare services is another thing that our team can do. So that includes, maybe trauma history, but also if a youth is LGBTQ+, and needing some gender affirming care, right? That's a great reason to reach out, and we can help them connect to providers who can do that. If the youth has a chronic health condition, right? So we know that youth in child welfare are, more likely to have certain chronic health conditions, and we have care coordinators, care managers who can really help navigate the ongoing health needs of chronic conditions like asthma, diabetes, obesity, and sickle cell. Help with durable medical equipment or medical supplies if that comes up. Home health, making connections to community resources and supports. We also get notified if any of our members enter the emergency room. And so, especially if they are going in for maybe some suicidal ideation, we will reach out and really make sure that there is some good safety planning in place and some suicide prevention work that we can provide as well, and really making sure that the youth gets connected to ongoing services, that they have the supports that they need, and that, the family isn't really, left in the lurch, right? Sometimes it can take a little while to get WISE set up when a youth is discharging and really needing some supports sooner than that. So definitely our teams are here to help. We really work ongoing with caseworkers and caregivers and youth, right, to determine how to achieve goals. Healthcare coordination can be a one-time request, right? I need help finding a provider for, this surgery that a youth needs, or ongoing until issues are resolved, and it can be reopened at any time. So if they have a need this month and then a need next month and a month after that, they can reach out as many times as needed. So here's the fun part. So, some of the pieces we just went over, what's covered by Apple Health, right? That's available for anybody with Apple Health, regardless of whether or not it's coordinated care. But these are coordinated care's value-added programs. So these are the things that are unique for our members, and especially for our members in Apple Health Core Connections. So this is my favorite part of the presentation here. So the care management, right, care coordination, we talked about that. Boys and Girls Club. So our members are eligible for a no-cost membership for Boys and Girls Club in their community. So sometimes there's additional, camps or programming that costs additional on top of the membership fee. And so coordinated care does not cover that, but we do cover the base membership cost. You should also know that Zia and myself do lots and lots of training with Boys and Girls Clubs across the state to really help make sure that their staff are aware of the needs of youth who might be involved with child welfare or who have been adopted. So their staff does a lot of trauma training with us and resilience training with us, which has been a really great partnership. The 24-hour nurse advice line, again, they call that main 844 number, and they can connect to that nurse advice line. That's great if a family's kind of debating, do we need to go in for urgent care? Do we need to go into the ED, right? That's a great time to call us. The rewards program, I'm gonna send you a flyer with more information on this rewards program, but this is available to everybody within our Apple Health Core Connections program now. So back when we started, this was not available for children and youth in foster care, and it now is, which is so, so great. So when youth go in for their annual well visit, they can actually earn money on a Visa card that gets mailed out to them. And then they can use that Visa gift card lots and lots of different places on lots of different things. I've heard of families putting it towards a bike, or, I mean, it's not that much money. It won't cover the entire cost of the bike, but kind of covering a portion of it. Or I've heard you know, being able to use it for hair care products, right? All kinds of different things. So for an adolescent who maybe is struggling with going in for their annual well visit, maybe kind of letting them know about that rewards program is a good thing a good incentive for them. Healthy Kids Club. So Cece the panda is our mascot, and she is slowly starting to see her social calendar get a few things back up and running. If it's ever helpful to have a giant panda at any events that are happening in your community and where families might like to learn more about Medicaid, you can feel free to reach out to me, and we can see if Cece can make that happen. And we put a little green Band-Aid on her so everybody knows she's been vaccinated. And then Start Smart for your baby. If you work with a youth who is pregnant, this is a program for them, right? So through this program, they have to complete a notification of pregnancy. And once we get that notification of pregnancy, we are able to provide them with a no-cost convertible car seat. So it's not an infant carrier that snaps into a base. It's the convertible car seat that goes from rear facing to forward facing, but is good for kids about 5 pounds up to 40 pounds, I think. So can kind of follow them for quite a while. And then also a double electric breast pump. They're eligible for that through the program as well. And then in addition, if it's a high-risk pregnancy, we can help get them connected to some community support programs. And we have some additional supports for our pregnant members as well. So those are some of the added benefits. We also have our liaisons. So Jenna Estroff and Michelle Wiley-Bunting, and they work really, really closely with DCYF. When anything gets complicated, they're our go-getters, right? They're kind of our internal advocates and really making sure that that needs don't fall through the cracks. And then Zia and myself are the community educators here in Washington. And Zia's in Spokane. I'm in Snohomish County in Edmonds, but I cover Western Washington and the peninsula. And we can do training and support for caregivers, adoptive parents, DCYF caseworkers, CASAs, providers, really any organization or agency that's going to intersect with our members who are in child welfare. So if you can think of other organizations that might benefit from some training from Zia and myself, feel free to make that connection. This program I am super, super excited about. I know I keep on saying that about a lot of things, but this one I really wanted to make sure people were aware of. So the past year, we have actually launched 3 foster care centers of excellence. So these are primary care providers that we have been working very, very closely with. And these 3 providers are really specialized healthcare providers who can serve as an integrated and trauma-informed hub, right? So the COEs can provide services to members on a one-time basis or serve as their ongoing primary care provider. They can provide specialized services for our HCC members, including that EPSDT or well child exam within 5 days. And so, cool story. One of our COEs had a situation where the family couldn't find a provider to do all 3 well visits for 3 siblings that had just come into care together. And so the family was looking at having to take, multiple days off of work, pulling kids from school multiple times to get all of those initial EPSDTs done. And we said, it might be worth it to drive an hour and a half to the COE, right? To do all 3 appointments at the same time. And that is what ended up happening. So really our COEs are going above and beyond to really help make sure that that those needs are happening in a trauma-informed way and trying to, limit the number of visits that need to occur and really providing excellent care. So they all are able to help with referrals to behavioral health, referrals to specialists, and can assist with getting durable medical equipment, and just all the needs that a youth may have. So here are the 3 COEs. We've got Harborview Pediatrics Clinic in Seattle. For those of you that might be used to the foster care consult clinic within, this is a little different than that, right? So Harborview has both the foster care consult clinic and then their pediatric clinic is this foster care center of excellence that can serve as primary care. So the consult clinic does kind of the longer evaluation to determine the needs of a child, but the pediatric clinic is the primary care that can follow kids ongoing. Excelsior Family Medicine in Spokane, and then the Community Healthcare Foster Adoption Clinic in Tacoma. So those are currently the 3 COEs that are available. And if you have any questions or you have, you'd like to kind of learn a little bit more, you can feel free to reach out. Our other latest program we have is Harvest Bucks. So this is available for our members. It's a partnership. Coordinated Care Harvest Bucks is a partnership with the Washington Department of Health and Safeway. And it's designed to address food insecurity by increasing access to fruits and vegetables. So really great program. Basically what happens is members can request it directly from us, or if they happen to go to one of our initial providers that's kind of launching this program with us, their provider could actually hand them this, prescription, right? So it's a $10 card that can be used at Safeway on fresh fruits and vegetables, canned fruits and vegetables that have no sugar added or salt added, as well as frozen fruits and vegetables that have no added sauces or fried potatoes. So those are the limitations for it. And members can actually receive up to 10 of these per year, but the voucher itself is worth $10. It can be used in conjunction with SNAP benefits, and it's just a really great program. So if a family that has coordinated care might benefit from this and is currently food insecure, we know that food insecurity is a major social determinant of health, and we would, you can encourage them to email this foodrx@coordinatedcarehealth.com to request that coordinated care Harvest Bucks. So it's a really new program, but we're really excited about being able to launch it and kind of figuring out more ways to get the word out. But for right now, they can send us an email if they would like one of these vouchers and are our member. Healthy Kids Club, we've got some online resources around, different health topics in the health library. And again, there's CC the Panda. If you need any help with a panda mascot and event, you can feel free to reach out to me. 2 more, we're almost at the end here, I promise. I've got like maybe 2 minutes left and then open it up for questions and comments. But 2 more kind of benefits that are available just for our adoption support members, right? So the adoption's finalized and the youth is still with Apple Health and with Apple Health Core Connections. And our members who are 18 and over, right? So those alumni members, they can access the Safelink cell phone program. This is a federal program, and it provides a no-cost cell phone to that individual. And it comes with, I can pull up the flyer. I'm trying to remember, there have been a couple of changes over the years to this. It's about 350 minutes, unlimited texting, and then there is also a small data plan component of it. In my doing some workshops with youth directly, I've gotten some feedback that some youth do not like the smartphone that comes with the Safelink program. So have learned over the years that when applying, they can actually request just the SIM card, and then they can put it into a cell phone of their choosing. So it comes with a smartphone, but not necessarily like the latest iPhone or, Samsung Galaxy or whatever. Yeah, and then the online member account. So again, not eligible right now for youth who are in an out-of-home dependency, just because we don't have a way to kind of figure out what happens when they change placements, who's having access to their health information, right? So that online member account is only available for adoption support members and our alumni members at this time. But they can set up an online account, and from there they could print, a temporary ID card if they lost their ID card, see some information about claims that have been submitted or prescriptions that they have, and that kind of information. So the online member account is a great resource for our adoption support and alumni members. And let's see. So this is just kind of our general accountability and transparency slide. If you're kind of curious who oversees our Apple Health Core Connections program, Maureen Sorensen is our new Apple Health Core Connections Senior Director of Operations. And then Kelsey Potter is our Executive Director of Medicaid. And then also you can see some contacts for the Healthcare Authority as well as DCYF for kind of some other oversight contact information. Keeping you updated. You can go to our website if you're looking for trainings that Zia and I offer, or maybe to share with caregivers that you think might benefit from some training. So that's on the Medicaid events site. And then Zia and I generally both send out some emails. So if you're not on my listserv or Zia's and you'd like to be, you can feel free to reach out and we'll add you to that. Again, here's how to contact us at 844-354-9876. Really encourage caregivers to save this number in their phone. And then again, there is that email address at hccteam@coordinatedcarehealth.com. And then the Healthcare Authority's foster care medical team, they really manage eligibility and enrollment in the program. So again, if you have one of those situations where it's kind of unclear if they're in the program or not, and you reach out to us, we can help with that connection to the foster care medical team and help check on eligibility too. But there's that contact information. And let's see, there's Michelle and Jen's contact information. Again, there are liaisons. I call them kind of our internal bulldogs or advocates. They really help with those kind of sticky cases and work very closely with DCYF. Again, there's Zia, and my information is community educators. And we are at the end. So this is my stretch slide. So take a moment. If you need to do some of those dog yoga poses, go for it. If you need to dance like a panda, go for that too. I haven't seen any images of pandas doing yoga. So if you have questions about Medicaid services, you can feel free to reach out to me. And if you ever find a picture of a panda doing yoga, please send it my way. And that is, I think, all I have. So I will open it up for questions for our last 14 minutes here. Yeah, I appreciate these sorts of coalitions of resources. Yeah, helpful. Oh, I'm so glad. So glad.
I have a question for you, Lindsey.
Yeah.
And you can shoot me later. Vaccines for youth. Can you give us an update on kind of where you guys are with that?
Yeah. So are you talking about COVID vaccines?
Yeah.
Yeah. So there is a process and a workflow for youth who are eligible for the vaccine, which right now is only 12 and up, right? We obviously know there's some 5 to 11 stuff on the horizon. So there is a grid for kind of workflow and process for how to do that I am pretty sure we can share externally. So I will get that out to you as well. But basically, if they are, between 12 and 18, the first step is really to reach out to the caseworker, right? If they are interested in the vaccine, step one, really reaching out to that caseworker. And then for 18 and up, right, they can go get that vaccine if they're in extended foster care.
Are you guys doing any kind of like outreach or things like that to essentially bio parents and stuff like that about the process, or if you just curious?
Yeah, you mean like for youth that are maybe in a trial return home currently?
Yeah, or just, the parents are going to be the ones that have to approve the vaccine, right?
Yeah.
So.
Yeah, I mean, we don't necessarily have the contact information for a parent, right? If they're not listed as the caregiver in our system. So no, I don't know of any, direct outreach we're doing around education on that directly to parents. No, I can't say that I know of anything we're doing on that front.
Thanks.
Yeah. All right. What is the application process for young persons applying for extended care? My working understanding is that it is very easy for youth to fall into an institutional crack at their 18th birthday. There is no process. This is the best thing ever that I love about our program so much. Thank you for asking that. The youth is categorically eligible for Medicaid through the month of their 26th birthday. So that means no action is needed. They are automatically still covered no matter what. So there's no income eligibility. There's no other eligibility factor. The fact that they were in care on their 18th birthday means that they have Apple Health coverage through the month of their 26th birthday and no action is needed. And so, right when we started in 2016, it was finding all these people that got enrolled in our program that didn't necessarily even know that they had Apple Health coverage, right? As we've kind of gone on a little bit longer, it's been a little easier to kind of help follow those those youth and those members. I am always happy to sit down and talk with the youth and make sure they know we have some slides that we can use directly with youth too, that really go into what are their healthcare rights around protected health information and family planning benefits and that as well. I didn't really touch on family planning much. So we can do that. Sometimes DCYF invites us to 17.5 staffings. I've met with youth with their treehouse advocate as well, if they have an educational advocate, or in the grad success program with treehouse as well, to kind of help explain some of that. So if you have a youth that's getting close to turning 18 and they have questions, you can feel free to reach out to me or to the team, and we can help make sure they get connected. Yeah. And then let me scroll back up here. What's the income eligibility threshold for reunified families? Yeah, so you probably saw that little asterisk in there. Kathy's got eagle eyes. Thanks for that question. So for reunified families, I probably should have called this out. If they want to remain with the Apple Health Core Connections program for 1 year post-dependency, the family has to be, or the parent has to be Apple Health eligible. So if the parent is on Apple Health or Medicaid already, then you kind of know that they're eligible. If the parent does not currently have health insurance at all, then they should apply for state benefits and see if they are eligible for Apple Health. I don't know the income eligibility, depends on how many people are in the family, all that kind of stuff. So I can't spit out a specific eligibility number for you, but they can go to the wahealthplanfinder.org website and apply for Medicaid there. Yeah. Oh, and Ryan, thank you so much for putting that evaluation in the link. Would really appreciate any feedback you might be able to give. And appreciate all these great questions. I know talking about Medicaid over a lunch break cannot always be the most exciting, but I love this stuff, and I'm so glad to see a good group of you all on today. So thanks for sticking with me. Let's see if I missed any other questions. I'm scrolling up here. Not seeing anything else come in. Hopefully your main takeaway is send me pandas doing yoga if you ever come across a picture, and 2, send me questions about Apple Health benefits if ever there's an issue coming up, and reach out to our care coordination team too.